The special education referral process. How do we identify and screen the students? Because of federal laws and regulations that govern the education of students with disabilities, a process has been developed over time that governs the special education referral process. There are 8 phases to this process. Phase 1, recognition. Phase 2, pre-referral. Phase 3, referral for special education evaluation. Phase 4, special education evaluation. Phase 5, eligibility, FRAPE, F-A-P-E. Phase 6, IEP meetings. Phase 7, IEP implementation. Phase 8, re-evaluation. Identifying the student. There are 2 primary ways in which children are identified as possible needing special education and related services. The system known as Child Find operates in each state and by referral of a parent or school personnel. All students begin their educational voyage with needs. For many, it is the need for guidance by a professional educator who can expand their knowledge and understanding of the world around them. While each student brings a different level of knowledge and skills to his or her first class, the individual needs are typically met by a highly qualified educator. However, there are children who have unique needs that are atypical for children of their age and may not be within the expertise of a general education classroom teacher. It is during this time that the teacher or a parent, administrator, or counselor may recognize a consistent need or problem exhibited by the student. The recognition of a discrepancy in the student's academic, social, emotional, behavior, and or physical ability with his or her age may signal the need for additional academic or behavioral supports. It is during this time it is important to call a meeting with the parents or guardian. The teacher should provide examples of the student's work and or anecdotal classroom notes regarding the student's needs. So the considerations will be, is the issue a reoccurring problem or new? Is the issue constant? Is the issue appropriate for the child age? Is it possible that the problems that are being exhibited by the student may be solved with careful execution of a cooperative plan of action between the teacher and the parent? The teacher and the parent should document their plan of action, strategies utilized with the student, and progress. The teacher should continue to collect student work samples and keep assessment data relevant to the student's unique needs. It is crucially important that the teacher document all actions and strategies used in the classroom and the impact on the student. The student's parent or guardian should be kept informed of any changes in the student's progress. The pre-referral step in the special education process is more formal than providing simple and temporary accommodations for the student. Pre-referral intervention is to identify, develop, and implement alternative educational strategies for students who have recognized problems in the classroom before the student is referred to special education. Pre-referral intervention is typically conducted by a student-centered team. The pre-referral team usually consists of the teacher, the parent or guardian, an administrator, other general education teachers, nurse, guidance counselor, or any other adult involved in the education of the student. The general education teacher provides background information regarding the problem exhibited by the student, and the team works together to develop possible solutions. Because of changes to IDEA in 2004, many states and independent school districts have begun using a more formal and systematic pre-referral process called Response to Intervention, RTI. RTI provides 3 levels of intervention for students who are experiencing problems. Generally, the first level, Tier 1, is focused on utilizing high-quality general education instructions in the core curriculum with all the students. RTI theorizes that around 80% of all students will respond positively to core curriculum and behavioral systems. The second level, or Tier 2, provides targeted group instruction or some form of group remediation to improve performance. The RTI model believes that the second level services will improve performance for approximately 15% of all students. If performance does not improve in the second level, then the students are moved to the third level, which consists of intensive individualized intervention. Whether the school uses pre-referral teams or the more formal RTI process, the intent is to provide interventions that will help the student achieve success without entering special education. However, if these interventions do not improve the student's performance, then the student will be referred for an assessment to determine possible eligibility for special education services. Phase 3, Referral for Special Education Evaluation. If after interventions in the general education classroom, the student continues to experience difficulties, the students, teachers, and personnel may refer the child for a special education evaluation. Referrals are determinations of eligibility for special education services, may be initiated by the school personnel, which will include general education teachers, special education teachers, counselors, and administrators. The child's parents or legal guardian can also refer them. The official referral begins the formal process of determining eligibility for special education service. Once a referral is provided, the school must obtain consent from the parents or legal guardian to begin the evaluation phase of the referral process. Phase 4, Special Education Evaluation. IDEA requires that students referred for special education services receive a non-discriminatory, multi-factored evaluation. The school district is required to complete the evaluation within 60 days of the referral date. The evaluation is to be conducted by a multidisciplinary team that will consist of individuals who can bring different perspectives and expertise to the evaluation. Some examples of the team members would be the school special educators, general educators, parents and or guardians, physical therapists, occupational therapists, audiologists, medical doctors such as psychiatrists, ophthalmologists, and optometrists. The evaluation must be comprehensive and use evaluation tools and strategies that are technically sound and accepted. Most students receive a battery of formal evaluations that measure intelligence, achievement, behavioral, disability-specific issues, medical. However, informal observations and documentation of the student's past work should also be used during the eligibility determination meeting. Assessments may not be biased in regards to race, culture, language, or disability. The materials and procedures must be administered in the language and form most likely to provide the accurate information on what the child knows and can do. Phase 5, Eligibility. IDEA states that each child is entitled to free, appropriate public education. Special education services are one way to accomplish this requirement for some students with disabilities. Within 30 days of the completion of the evaluation, the individuals that took part in the process thus far will meet to determine eligibility. A student is considered eligible for special education services if the child has a disability as defined by IDEA, which negatively impacts his or her educational performance, or the child needs special education services in order to benefit from education. Not all students are determined to be eligible for special education services. There are multiple reasons why a student may not qualify for special education services, including not having a disability that negatively impacts his or her education. However, these students may need help to assess the academic curriculum. In these situations, the school will need to work out a plan to provide other services for the student. If the team determines that the student is eligible for special education services, then a formal Phase 6, IEP Meeting. The Individualized Education Program, or IEP, is a legal contract between the parents and the school district that describes the special education services to be provided by the local education agency, which is the local school district. The IEP documents vary. The basic parts of the IEP include a student profile that provides background information about the student, the IEP start and duration dates, a statement of special instructional factors, a statement of special transportation needs, a statement of opportunities to participate in non-academic and extracurricular activities with non-disabled peers, a statement of frequency and methods of reports of goals obtained by parents or guardians. Benchmark pages are included and focused on specific areas that need special education services. Measurable annual goals. Evaluations used to measure annual goals. Benchmarks to be achieved to meet the annual goals, and special education and related services needed to achieve the annual goals. A behavioral intervention plan, a BIP, if the student's behavior is a concern and a functional behavioral assessment has been done or needs to be conducted. For students 16 years or older, the plan and activities for the student's transition from high school will be addressed. The signature page, which provides a statement of least restrictive environment, LRE, and has the signatures of all members present at the meeting. The IEP team is composed of the following: parents or legal guardians, at least one general education teacher, at least one special education teacher, a representative of the local education agency, LEA, who is qualified to supervise the needs of the student, an individual who can interpret the instructions, implications of evaluations, which is usually educational psychologists or a specialty trained special education teacher. 7. IEP implementation. Once the IEP is developed and signed by the members of the IEP team, it is the responsibility of the entire IEP team to ensure that the IEP is implemented. The IEP team may meet as frequently as needed to discuss the implementations of the IEP. School personnel are required to provide documentation of the mastery of the benchmark and annual goals. The IEP document is a living document that can be altered during the school term if needed. The IEP goals and benchmarks provide the objectives for the education of the student and prescribe what services will be provided by the local school district and the school campuses to achieve those objectives. However, it must be understood that the school agencies are not required to meet all the goals within the school term, but they must provide evidence of a good faith effort towards achieving the goals. Phase 8, Reevaluation. Each year, the IEP team is required to meet for the dual purpose of evaluating the implementation of a current IEP and to develop the next annual IEP. During these annual meetings, the IEP team should discuss the positive and negative elements of the special education services provided and determine, based on any new assessment data, what services should be provided in the upcoming school year. While the IEP is redeveloped each year, the IEP team does not have to conduct the battery of assessments each year. At a minimum, the IEP team is to determine if formal evaluation is required every 3 years. However, the IEP team can ask that a formal evaluation be conducted more frequently if needed. There are times when, after the reevaluation takes place, it is determined that the student does not need special education services. An example of this might be a young student who has been provided speech and language services and have developed the ability to speak without a problem. It would be in this case that an IEP team would need to file appropriate documentation to support the fact that the student no longer is eligible for services, and the IEP team will be disbanded for this student.